Good afternoon and welcome to the Seminole County State of Emergency update here on the COVID front. We're also going to be, I just a moment ago exercised my signature to the state of emergency for the hurricane preparedness. And of course this is something we've talked about in the past is as we entered the hurricane season, one of our concerns was, and throughout the entire state, during the COVID pandemic, that we would actually find ourselves in another emergency with the hurricane or tropical depression, I guess at this point, that we continue to monitor. Alan Harris, our emergency management director, will talk more in detail about that and what's going on with the management of that and what's going to be happening around the county as we prepare for that. And so we want folks to pay attention, be alert. You can always, of course, I always say this and many of our speakers do, prepareseminole.org is where you find your immediate information. You can also sign up for alerts through Alert Seminole. You can find that information on the website, as well as much information not only related to the hurricane preparedness but also to the COVID front. I want to talk a little bit today about the ongoing, I think we're in day 133. I know many of us never envisioned that we would be dealing with this for as long as we have. I think we all have to agree at this point that we will be dealing with this for quite some time. So the important matter behind that is we cannot live in fear, but we need to be smart, we need to pay attention, we need to do what we already know is in the best interest of our residents, our fellow man, our businesses, because we must maintain the ability to conduct business and stay open here in Seminole County. So we're going to talk a little bit about some of the things here in the county that we're going to be doing, rolling out to help our small businesses as well as our community, or those that find themselves out of work or on furlough, and trying to help them with personal assistance. So get your ink pens ready. I'm going to give you a couple of web addresses as we talk today that would be very important for our community to have at their disposal to stay updated on these issues. One is we're launching the SeminoleSafeBusiness.com. It's a crowdsourced website to help recognize small businesses that are taking extra precautions to remain open safely. Now, the intent of this is to help educate the public of somewhere they can go where our businesses can share with the public what they specifically are doing to help make you feel safe as well as be safe when you come to do business with them. We continue to get calls at my office of residents and citizens who have concerns that maybe they've gone somewhere to do business and they're calling my office saying, hey, I went here and only half the people are wearing masks, and the guy that's preparing my food is cooking it with no mask, these kinds of things. So I urge our business people, please try to do what we already know is right so you can remain open and we can keep our economy flowing. As we know, many businesses have been forced to shut down on their own because their employees and many of their patrons have contracted the virus. So it is up to us, it's our responsibility to make sure that you're able to stay in business, and that falls on each and every one of us. We're going to do our part here at the county to help you get through that, but we have to rely on each and every one of you to do your part so that you can stay in business. We believe with precautions in place that we can fully remain open here in Seminole County. Visit the website at SeminoleSafeBusiness.com and you can know more about what your neighbors and your businesses are doing. We've also kicking off the CARES grant, business grant funds. We're going to talk a little bit about that as well. We'll begin accepting applications for the second round of small business grants on August 19th. The process will be fully digital. In anticipation, we are going to give out business grants between the $5,000 and $15,000 per business. So again, at the county, we're going to do our part to help our small businesses. In return, we need our small businesses to do their part to make sure they stay in business, because the last thing we want to do is award grant money and unfortunately you end up closing down because you didn't take the proper precautions to remain open. The process will be pretty much seamless. There will be help and assistance if you need assistance in gathering your paperwork. That will be done through our website or through our phone number at 407-665-0000. The $5,000 grants will be awarded to home-based businesses that have one W-2 employee that is not the owner, as well as a mobile business. This was a big question a lot of people had during the first grant that we rolled out. The $10,000 grants will be awarded to businesses with 2 to 25 employees. $15,000 worth of business grants will be awarded to businesses with 26 to 50 employees. We anticipate that the majority of our businesses are going to probably fall in the first two categories, the smaller businesses, the small family-operated business. But you are eligible for the $15,000 grants if you have employees with a business 26 to 50 employees. Interested applicants should visit businessinseminole.com. Again, that's businessinseminole.com to find a preliminary list of frequently asked questions and a checklist of necessary documents. Why is this important? The reason this is important is we want you to start gathering your documentation now, not wait until the 19th when the website opens and then be clamoring around trying to find all your documentation. So on that website, you will find a checklist of the initial documents that you will need, so you will have them at your disposal. So as soon as the website is up on August 19th, you'll be able to seamlessly go in, enter that information, and get your process moving. The county has already awarded $1.2 million in grant money to the first set of businesses on our initial grant process, the CBDG funds. So that money will be going out this week. Checks will be cut this week and going out to those applicants that qualified, so you'll have that money coming to you very soon. The county is also following up with the eligible business that did not complete their applications fully in the first round to determine if they can meet the criteria for the second round. So many of you who filled out, I think there's somewhere around another 150 businesses that have not completed their paperwork on the first round. You know who you are. If you're not sure who you are, you're probably one that was not notified you're getting any funding. So you need to pick up the phone, make a call, make sure the documents that you're missing so you can gather those up. We've partnered with some of the chambers and other business people to help you understand what those documents will be. So our goal is we want to do our part to help you get this as quick as possible. We should be awarding another $1 million in the coming weeks prior to the rollout of the August 19th, which is going to be $10 million, and that's going to be the 5,000 to 10,000 and 15,000 increments based on your employee count. We also are rolling out the Seminole Cares individual residential grants. This is for personal assistance. We're investing $7 million for individual assistant grants up to $5,000 per household, depending on what your housing costs are. And that's going to be based on information to help pay eligible utilities as well as mortgage and or rent assistance. This will also be, the whole hope is to give you a bridge in the gap from your unemployment or your loss of employment until you find additional work. This is a program to help those that don't qualify for a business type grant. This will be a personal grant. So there's $7 million that we've allocated towards that. You must be a U.S. citizen as well as a Seminole County resident and a permanent legal resident in order to qualify. You must have experienced a job loss or a reduction in work hours due to COVID-19. So even if you still have your employment, but maybe you have been cut back to part-time, maybe you're working for a restaurant and maybe you can only work so many hours compared to what you're accustomed to. This grant can help you, so you need to apply for that as well. Seminole Cares Outreach information. You need to stay tuned to our Facebook page here at Seminole County, our Twitter, Instagram, and Nextdoor accounts, as well as live chat for informational sessions on both. Here at the EOC, we have public information people that roll out live Facebook webinars, as well as all types of social media to get this information in the hands. But you can always go to prepareseminole.org and find that information. All those webinars, all those Facebook pages remain on the website, so you can go back and look at them at any time. Today we have the Supervisor of Elections, Chris Anderson, with us today. He's going to be here to discuss the deadlines for the August primary election, also ballot changes due to withdrawn candidates. We also have Miss Susan Forbes from OneBlood, who's going to share information for the need for convalescent plasma and how you can donate, as well as upcoming Seminole County blood drives that offer free antibody testing, and the urgency of donations prior to the arrival of this storm. Closing out the afternoon will be Mr. Alan Harris, our emergency manager, with COVID updates, as well as information on tropical events and share the information about the sandbags for those that may need sandbags throughout the county, which we kicked off at 8 o'clock this morning. So with that said, we're going to bring our Supervisor of Elections up here, Mr. Chris Anderson. Thank you, Mr. Anderson, for being here and speaking to our community. Thank you.
Thank you, Chairman Zembower. I appreciate the opportunity to come before you. I wish everyone that is in attendance and watching well. First, let me address a few things. The August primary election on August 18th. I know some of our voters have received their mail ballots in the mail. There is, in the tax collector race, the candidate Joel Greenberg. He is on that ballot. However, he is a withdrawn candidate, which means that any votes that are cast in his name will not count for the August primary election. He withdrew from the race after the ballots were printed. However, any subsequent vote by mail requests that come in, we will be providing an insert that will explain just that. We also immediately place that information on our website and on our social media platforms. And that's a good time for me to put in the social media plug. To get the most up-to-date information regarding the Seminole County Supervisor of Elections Office, I encourage you to follow us on Facebook, Instagram, and Twitter. We have a Twitter feed that stays on our website continuously. The second thing I'd like to address also is I have learned that some of our voters have received some misleading political mail. It may be in reference to vote by mail. Seminole County was the first county in the state of Florida to send out vote by mail requests to all 320,000 voters. We did that in April. We got that out very, very early. And now we've had some third-party groups that are now send out some mailers in the range of about 80,000. That's created some confusion. I urge all voters that are considering voting by mail that have done their vote by mail request to go online at voteseminole.org and click on My Record, and you can check to make sure that your vote by mail request is up to date. And also you can call our office at 407-585-VOTE. That is 407-585-8683 to confirm that your vote by mail request is still current, because the confusion is that they are receiving this information and it is that they believe it's coming from the Supervisor of Elections Office because the return envelope, the business reply envelope, has the Supervisor of Elections Office address on there. So we have not sent out anything. Additionally, there's something that we did exclusively for Seminole County voters. There is a website called officialelectionsmail.org. If you go to officialelectionsmail.org, you can check to see if the mail that you are questioning came from the Supervisor of Elections Office. Okay, so that is something that you can do that is exclusive to Seminole County voters. We created that so you can check to make sure that the mail that you are receiving came from the Seminole County Supervisor of Elections Office or not. Okay, so let's talk about the election, the primary election that's coming up. The election date is Tuesday, August 18th, 2020. Now, to let you know, book closing, otherwise known as registration closing, it has happened. It has passed. That was July 20th. That was the last day for you to either register to vote or do a party change to be able to participate in the election, the primary election. Now, really quick with vote by mail, there is still time for you to request your ballot. You can do that to have it mailed to you up until August 8th. So don't delay. And also, when it comes to your vote by mail, once you get it, make sure you turn it in. Don't wait, get it in so we can get it counted. And remember, you can track your mail ballot if you go to trackmymailballot.org. Trackmymailballot.org. Okay, you can track it. All right. So, Election Day, I'm happy to report all 80 of our precincts will be operational in Seminole County. We will have 80 precincts that will be open from 7 a.m. to 7 p.m. 7 a.m. to 7 p.m. Those would be the voting hours on Election Day. Early voting. We have 7 conveniently located early voting sites that will be operational as well. They're operate, and the dates for early voting is August 8th to August 15th. August 8th to August 15th. And the operational hours will be from 10 a.m. to 6 p.m. Now, quick note. If you are a voter who frequently votes early in the Oviedo Winter Springs area, I have good news for you. We have procured a larger voting space within the Oviedo Aquatic Center, which will allow us to process even more voters more efficiently. There's also the early voting location, which is the Oviedo Library, which is right down the street. So you can choose to go to one or the other. And that leads me to my next point. We're asking voters to have patience, okay, as we go to these stores, the Publix, or any shopping mart, any of the shopping stores, Lowe's, all those places. We have to socially distance. We have to control the occupancy rate. There will be no different inside of our voting rooms. So as you come to vote, please have patience. We will get you in and out as quickly as possible. All right. Also, our election workers, they will be required to wear masks and gloves. They will be equipped with hand sanitizers. They will have alcohol disinfectant and wipes. They will be sanitizing all booths. We created another election worker position, which will be responsible for sanitizing all of our voting booths. So no voter will enter a booth until it has been sanitized first to keep everyone safe. Additionally, there will be safety shields in between the voter and the election worker at all of our check-in tables. We procured all of those, all right? So no voter will touch the same stylus. We have the disposable stylus. That is a Q-tip wrapped in aluminum foil tape that will conduct static electricity from your body to the screen that will allow you to safely sign, to check in, to receive your ballot. And the very last thing is the Secrecy Sleeves. They are one-use Secrecy Sleeves. So every voter that comes to vote in Seminole County, the only thing that they will touch again will be the pen. But that's only after it's been sanitized and 70% alcohol. So we are doing everything that we can to make sure that all of our voters remain safe as we continue in this COVID-19 era. Lastly, our vote-by-mail turnout. Our vote-by-mail turnout. We have mailed out, as to date, 88,000 vote-by-mail ballots. To give you an idea of that, in 2016, the entire election was only about 20 to 25%. So we are at 88,000. That's just in vote-by-mail. We have about a 10% turnout in that, so it's just because it's early. So please don't delay. Turn your vote-by-mail ballot in today, okay? I don't have anything else. Thank you very, very much for the opportunity, and I will turn it back over to our chairman. Thank you very much, sir.
Thank you, Mr. Anderson. Ms. Forbes with OneBlood will now come up and talk to you about blood donations. Ms. Forbes, welcome, and thank you for being here today.
Thank you. Good afternoon. Thank you for having us here today from OneBlood. I'm Susan Forbes, and we wanted to let you know that OneBlood continues to experience a urgent need in our community for people who've recovered from COVID-19 to please contact OneBlood to make an appointment to donate their plasma. People who've recovered from the coronavirus have the ability to donate convalescent plasma. They have antibodies that develop that remain in the plasma portion of their blood, and by transfusing that plasma into a patient still fighting the virus, it could potentially boost their immune system and help them recover. So OneBlood has seen an extraordinary increase in the need and orders coming in from our hospital partners across our service area. As the number of cases rise throughout Florida, we see that it goes hand in hand with the need for more convalescent plasma. We have had over a 500% increase in orders coming from our hospitals for convalescent plasma, and that need is urgent, that people who have recovered, please step forward to donate their plasma. It is truly an all-hands-on-deck situation at OneBlood, where we are collecting, testing, processing, and distributing convalescent plasma around the clock. It is urgent. As quickly as the donations come in, they are processed, tested, and they are on their way to a hospital. So it makes the need for this ongoing. This is something that is needed now, and it is needed going forward, because there is no end in sight at this point of the virus, and that means the need for convalescent plasma remains. These are very specific donors that we are looking for. Only people who have recovered from COVID-19 can be potential convalescent plasma donors. So to do this, you also need to make an appointment with OneBlood and register at oneblood.org. So if you've recovered from COVID-19, please go to oneblood.org and register and see if you meet the criteria to be a convalescent plasma donor. You really are the people who hold that potential key for helping many of these patients heal. We have seen this surge for convalescent plasma because not only are there more people being diagnosed with COVID-19, there is also hospitals using convalescent plasma earlier to treat patients. So those two things combined have created a surge in usage, and this is why there is this urgent call for more people who have recovered from COVID-19 to become convalescent plasma donors. We put the all call out about 2 weeks ago for an urgent response, and we have seen people respond, and we thank you for that. We need a sustained response as well, because this is for the long haul. The good news is that once you donate once, you can donate again every 28 days. So we encourage you to please make it a habit. Plasma can be donated every 28 days. So it is that ongoing need, so it's important that, just like the regular blood supply, that we make it a habit and donate each time you're eligible. By doing that, you are making sure that we have that ready convalescent plasma supply available at all times. In addition to the urgent need for convalescent plasma, we continue to have the regular blood supply needs as well. So we kind of have two tracks of the blood supply going at OneBlood. You have the convalescent plasma supply that is going to help COVID patients, and then you have the general blood supply, which is needed every day to help patients throughout our service area. Cancer patients, premature babies, sickle cell patients, trauma patients. The list goes on and on of the number of people who require blood on a regular basis to live. And the only place it can come from is from a blood donor. And they truly are unsung heroes in our community who are giving people a second chance at life. And we encourage you to please continue to make regular blood donation a habit as well. We have a potential storm that could be moving into our area. We need a ready blood supply before, during, and after that storm. There are still people in the hospital riding out these storms who need blood, and there are people in there who need convalescent plasma as well. OneBlood is partnering up with Seminole County government here. They're hosting several blood drives, which we thank them for, that will be taking place throughout several of the parks throughout Seminole County. So you can go to oneblood.org to make an appointment to get on the big red bus at one of those blood drives that will be taking place. This is important that the regular blood supply continue moving like this as well. The pandemic has really impacted our locations as to where we can go and host blood drives. So this is a great opportunity to go to one of the parks in Seminole County and donate blood. We will also, all those donations are being tested for the COVID-19 antibody. So if you donate at one of those drives, and at any drive with OneBlood, your donation will be tested for the COVID-19 antibody. You will be able to see the results to your antibody test about between 2 and 5 days after you donate by logging into your donor portal at oneblood.org, and you will see your result. And people who test positive for having the antibody will be able to be potential potential convalescent plasma donors. So you'll be able to help two times around. So that is taking place coming up. You can find all that information at oneblood.org. And lastly, for the people who are considering being a convalescent plasma donor, again, it's very specific donors. You had to have recovered from COVID-19. You also will need to provide a confirmed positive test that you had COVID-19, either from a lab or a hospital, and be 14 days symptom-free. If you don't have the lab test, you can also provide an antibody test. And again, you need to be 14 days symptom-free. You register at oneblood.org. Our team will, we have a whole team behind the scenes monitoring all of the intake of those forms. They will reach out to you to schedule your appointment and let you know where you can go to make your convalescent plasma donation. So we appreciate everybody who has turned out thus far. Thank you.
Thank you, Ms. Forbes. Alan Harris, Emergency Manager of Seminole County, thank you. I want to give you an update on COVID-19 operations here in Seminole County, as well as give an update on potential Tropical Cyclone 9, soon to be named, it looks like, Tropical Storm, I hope I can say this right, Isaias, I believe that's correct. I'll get that down. I'm sorry to report, so I'm going to give some bad numbers, unfortunately, at the beginning. Hopefully a little bit better numbers later on. I am sorry to report the fatality count has doubled in the last 2 weeks. Today, Seminole County was notified of an additional fatality, making the number 72. A majority of these individuals are 55 and older with underlying medical conditions. We have also seen an increase in the number of COVID-positive patients in assisted living facilities and nursing homes here in Seminole County. The number today stands at 242 residents inside of those facilities and 178 staff members in assisted living facilities and nursing homes. This number has grown, and we have pushed an additional teams from the Florida Department of Health, the Agency for Healthcare Administration, and incident management teams, which are consistently going into the facilities to review infectious disease control measures, enhance testing, and at the Office of Emergency Management, we're delivering additional personal protective equipment so individuals can be isolated and quarantined to prevent the spread of the virus inside of these facilities. Our current positivity rate for testing here in Seminole County is at 10.12, which is above the target range. We have seen that go up over the last few weeks. And we hope that number will start to come down, but right now it is at the target range, right around the 10%, which is where we want to be. Below that, we're a little bit above that at this particular point. Even with those bad numbers, we are cautiously optimistic at some other numbers. Our current positive cases in Seminole County has remained relatively consistent for the last 2 weeks. Our current positive rate right now, number of individuals positive inside of their home, is 3,299. That is, 2 weeks ago we were at 3,250, so just 49 above 2 weeks ago. Obviously, new cases have come in. We see about anywhere from 70 to 100 plus new cases per day, and of course, at the same rate they're falling off. So it's remaining relatively consistent. People are recovering. But unfortunately, people are getting COVID at the same time. Hospitalizations have started to decrease over the last 2 weeks, so that's also a good number. 2 weeks ago, hospitalizations were anywhere from 215 to 250. Right now, the count is at around 150. Just a few moments ago, when I left the Emergency Operations Center, it was at exactly 150 in all 4 hospitals here in Seminole County, a decrease over the last 2 weeks. Both of these numbers demonstrate that the measures we have put in place are starting to work, we believe. We anticipated, and as well as many other counties, anticipated a bump. We saw a bump after Memorial Day. About 2 weeks after Memorial Day, there was a spike in the number of cases. There should have been that spike based on all projections after the July 4th holiday. It did not occur. The only difference between Memorial Day and July 4th were those protective measures that we put in place. Social distancing, wearing of masks, things like that. So they seem to be working at this point. In the midst of COVID, we were hoping that we would never have to prepare for a tropical event, and unfortunately, we are having to do just that. Potential tropical cyclone 9, which is a tropical low that is now near the Leeward Islands, could be at our doorstep this weekend, potentially late Saturday, and then of course throughout the day on Sunday. Due to this, our timeline started back on Monday for activities that we have to do in the Emergency Operations Center to prepare for a tropical event. In emergency management, whether it's at the county level or at the state level, we always plan for the worst and prepare for or hope for the best. And we are planning for the worst. Right now, the particular event is slated in intensity forecast to just be a tropical storm. We hope that it does not reach Category 1 strength, but in emergency management, again, we plan for the worst, so we are planning for a hurricane here in Seminole County. Since we are in the cone, we are going to continue to plan until we are not in the cone of danger. So what we have done over the last few days and into the next couple days, we have prepared all of our shelter supplies to open up shelters potentially on Sunday if the storm track intensifies and starts to move towards Seminole County. Today we conducted just-in-time training with Seminole County Public School and Seminole County staff. New staff that will be helping to manage and work inside of the shelters. Many individuals, of course, that have been with the county or the school board for a while are well versed in shelter training, as they've dealt with Hurricanes Matthew, Irma, Dorian, even last year, because we did open up the shelters even though the storm never hit us. We did have folks in the shelter in preparation for the storm in case it wobbled into Seminole County. We do have, of course, some new staff that needed training, and of course we did that today. As the chairman mentioned earlier, Sandbag Operations began this morning at 0800 at the Seminole County Boom Bah Sports Complex, as well as the city of Sanford. Tomorrow, the city of Oviedo will join us in offering sandbags, and the city of Altamont Springs will open up Sandbag Operations on Friday. We are working with our vendors to support each of the shelters. Each of our general population shelters have an ambulance station there, as well as our special needs shelters have advanced life support systems, ambulances at each one of those facilities. Additional nursing staff will be at each one of the facilities' special needs shelters, as well as the general population shelters. Over the last 2 days, we've been conducting needs assessments with all the COVID patients, and as I've said since March 2nd, we've been contacting each of the COVID patients regularly to check on them, make sure that they have all their needs taken care of. And one of the things we would hope that we hoped that we would never have to ask them is, where do you plan to evacuate? So that is what the question is at this point, is if this becomes a hurricane and it moves over this area, if you live in a mobile home or a manufactured home, or you live in a low-lying flood-prone area, where do you plan to evacuate? Do you have a place? And if not, we're going to provide assistance for those individuals in an isolation shelter away from other individuals so that they can get the care that they need. Tomorrow we will be reaching out to all of our special needs clients, individuals that require power to run electrical devices, as well as require oxygen. This is a good time for me to remind individuals, if you do need power to run a medical device, or if you require oxygen or medical care, to please register for your local, and it doesn't, even if you're hearing me in another county, register for your local emergency management office's special needs program. Every county in the state of Florida has a special needs registry. And what does that do for you? That allows us in emergency management to prepare for you, so that we know what types of needs you will have when you arrive at a special needs shelter. If you need transportation assistance, we provide transportation assistance. We need to have this information so that we have the proper medical staff there, that we have the proper equipment there, that we have the needed medical supplies necessary to take care of you when you're there. So please register for the special needs program if you have that need. We are also in the preparation and the planning stages of opening up our complex medical condition shelter, and that's for individuals with trachs, vents, and things like that. For Seminole County residents that have those, they would still register for our special needs program, and we would work with them individually to find assistance for that particular need. We have been pushing out information through our fire department on generator safety. That is, of course, a concern for us this year, as it is every year when there's a hurricane. So we want to make sure that that is done safely. And our citizens information line, which has been staffed Monday through Friday to answer COVID-related questions, of course, will be available and is available to handle any tropical storm-related questions. We will be extending the hours. We were Monday through Friday. Of course, we will be working through the weekend, so Monday through Saturday at least. If the storm starts to move off the coast, we'll make a determination if we need to open up shelters on Sunday, and if we need to continue to keep the Citizens Information Hotline open on Sunday. If it moves way far away from us, we may not need that service. And with that, I'll open up for questions. You want to do that? Any questions?
Alan, obviously there's a lot of, the unknowns as far as storm intensity, track, and all of that. But COVID obviously throws in the new wrinkle. How are you going to do with shelters? Are you going to have a separate shelter for people that may be symptomatic for COVID, or will you keep them separate within the same shelter?
Okay, so that's a good question. So how will we split individuals up at the shelters? Yes, individuals that have tested positive for COVID, we're contacting each and every one of them this week. We're identifying if they live in a mobile home, manufactured home, or if they live in a low-lying, flood-prone area, and if they need to evacuate. We have a special shelter for those individuals. We have the general population shelters, which are for individuals that have no other place to go. We encourage people, find a friend or a family member. That's always the safest thing. Someone that goes to your church, someone that belongs to your social club, service organization, Rotary, whatever you belong to, it's always best to go to someone that you know that lives in a concrete masonry block home. If there's no other choice, you can go to an emergency shelter. In an emergency shelter, we will have a triage station. Before you even come in the door, there will be a series of questions, temperature checks, things like that. Masks are required inside of an emergency shelter. If you don't want to wear a mask, then you need to seek some other type of assistance, some other type of shelter. The emergency shelters will require that individuals wear masks when they're inside. Social distancing will also be a requirement inside of the emergency shelters. In every emergency shelter, and a lot of people don't know this, but and it may be morbid, but this is part of planning. So in every emergency shelter, emergency management designates certain rooms. There's always an isolation room, not just for COVID. There's always an isolation room. That's for someone that gets sick while they're in the shelter, the flu, whatever it is. There's a morgue room because people pass away during storms. So there is a room specifically designated for that. There is a room designated for Alzheimer's and persons with dementia and things like that. So there are a lot of different types of rooms that are built into the shelter plan, and that is in every single shelter that we open. So we have contingency plans for movement of individuals that we know are COVID, and then individuals that may present symptoms after they're already in the shelter, maybe a day, 2 days later.
And so I'm clear, when you said people to go find a friend who has a concrete block house, is that anyone who may need a shelter or people who are in the COVID realm?
No. Anyone, if you live in a mobile manufactured home, you know that you're going to be evacuating. The general population shelter should always be the absolute last choice. It's the refuge. If we call it many people now, FEMA calls it the refuge of last resort. This is the last option to get to, especially this year. We're going to have the triage stations, but people are asymptomatic. We're going to do our best to make sure that people are social distanced, but there's only so much social distancing that you can do when you're trying to put hundreds of people inside of a building. So, the safest, best thing to do, go to a friend or family member's house.
Alan, you mentioned that you've already started contacting positive patients that you're still keeping in contact. Any idea of how many COVID positive patients could be going to this isolation shelter if needed?
Yeah, so the question is how many individuals at this particular point are going to have to go into a shelter. Actually, the number was quite low yesterday. I was shocked at how low it was. Less than 10% will need some type of a facility like that. We're still getting the numbers because we're now calling people every other day. So yesterday was our first day. We called half the individuals yesterday. We're going to call, we are in the process right now upstairs at the EOC. They're calling the individuals. We still have some calls waiting to come back. So it's well under 10%, more like 3 to 5%.
And you mentioned hundreds of people at the general population. Are you having to open more general population shelters to offset so you don't have as many people in
Yes, so
one?
that's a great question. So the question is, are we having to open up more shelters? Yes. When we would normally for a tropical storm or a hurricane, we would open up maybe one shelter. We're looking at opening up 4. If heaven forbid this year we see a category 2, 3, 4 hurricane, we could be opening up upwards of 18 shelters. So where a high school normally you can put 2,000 to 3,000 people in that during a normal hurricane, this year that's going to be dramatically decreased, where you'd see maybe 200-300 people in there.
Yeah, I don't think we're probably going to see it in this circumstance, just because, unless the forecast is completely turned on its head. We often see a lot of lines at home improvement stores when, hardware stores trying to get supplies. How hard is it going to be to convince people that they still have to be socially distant while they're already have the anxiety of preparing for a storm? I guess part of it would be prepare yesterday.
Yeah, so the question is anxiety going to buy supplies at this particular point, and we agree. Now, if you can buy supplies, now's the time, of course, to buy them. And this particular event, hopefully, will just remain a tropical storm, and hopefully will remain out in the Gulf of Mexico. That's where it's starting to trend, and I hope that it continues to trend that way. And if it continues to trend that way, this may be just a big exercise for us in emergency management. But it's a warning. It's a warning for us, those that can prepare, those that can buy disaster supplies. And I understand there's economic challenges. I mean, the chairman mentioned it just a few minutes ago, and we've all experienced it in some level. We understand some people just can't. They're at that point. But for those that can, we ask that they go and buy their disaster supplies now. Well, why do we ask that? Because we saw what happened in COVID. People went out to get toilet paper. They went out to get the basic needs, just some cleaning solutions, and the shelves were empty. Well, we've seen that in hurricanes over and over and over again. I mean, we know where you all will be as reporters before the storm approaches. You're going to be in front of grocery stores and hardware stores, and you're going to be talking about the empty shelves inside and the long lines. So if you can buy disaster supplies now, buy them now. What that does is it allows the supply chains to rebound. So that there's those needed supplies, those people that couldn't go get it beforehand. Now there is those extra battery. Now there are some flashlights. There are some those needed things that they will need, and they just aren't in a situation where they can buy them right this moment.
Alan, if you had to pick 5 things for your hurricane kit because you don't have a lot of funds, you're financially strapped, but as a family I want to prepare. 5 things that I should get that are cost effective, or I guess the top things you think I should get that are cost effective?
Sure, non-perishable foods, some simple tools. Those are just important things. Tools that you can use, tarps to maybe put on the roof to prevent any further damage. Heaven forbid something happens to the roof. You don't have to go out and buy a whole bunch of water. Just fill up the water bottles that you have, or if you have some milk jugs, clean them out. The water on the tap is good. I mean, you're drinking it right now. So just fill those up, put them in the freezer. Don't go out and buy a whole bunch of bottled water right now. The water that you have right now running out of the Seminole County's water is amazing. And so are all of our municipal water sources as well as our private water. So fill them up, fill those up, and you don't have to go buy a whole bunch of bottled water.
Buenas tardes, este va a ser el resumen en español por la conferencia de prensa hoy, el 29 de julio del 2020. Empezó hablando el presidente de la Junta de Comisionados del Condado, Zembower. Empezó hablando de el nuevo sitio de página de internet que el condado empezó esta semana, que es seminolesafebusiness.com. Ese sitio es donde pueden ir los residentes del condado para ver los diferentes negocios y empresas que están tomando las precauciones necesarias para estar seguro cuando están de compras o cuando están comiendo o lo que sea. Y ahí pueden ir en diferentes negocios que ven por el condado que están tomando estas precauciones. Después él continuó hablando del fondo de pequeños negocios que están dando el condado, el Seminole Cares. Empezó hablando que las aplicaciones para la segunda ronda empezará el 19 de agosto y va a ser completamente digital. Los fondos pueden ir de 5 a 15 mil dólares y esto es para diferentes negocios. El primer negocio es lo que tienen de la casa o si no móviles, que pueden recibir hasta 5 mil dólares en una vez, que pueden ayudar por lo que ha perdido por esta pandemia del COVID-19. Lo segundo es cualquier negocio que tenga de 2 a 25 empleados que pueden ganar hasta 10 mil dólares en fondos del condado. Y lo tercero, pueden recibir hasta 15 mil dólares en fondos de los negocios que tienen empleados de 26 a 50. Si están interesados en aplicar en esto, si hay negocios interesados en aplicar para estos fondos y piensan que pueden ser aceptados, pueden ir a la otra página que es businessinseminole.com, que ahí te dan toda la información, puede contestarte las preguntas que tenga y los documentarios necesarios para ser aceptado para este programa. El condado tuvo la habilidad de dar 1.2 millones de dólares a 120 diferentes negocios y empresas por el condado que fueron aceptados en las aplicaciones del mes pasado. El condado ahora va a estar contactando los otros negocios que no podían terminar las aplicaciones de la primera ronda del dinero, pero ojalá esta vez el condado está deseando de dar 1 millón la semana que viene y ayudar en el mes de agosto 300 negocios más. También habló que en Seminole Cares hay otro programa que da dinero para los residentes que fueron afectados por esta pandemia. En total hay 7 millones que van a estar ayudando a los residentes y pueden cada casa recibir hasta 5 mil dólares en asistencia. Todo dependiendo el gasto que tienen mensual en cada casa. El programa es un pagarés de una vez y es para ayudar a la renta, hipoteca o cualquier gasto mensual que tengan en su casa. Es para lo que quieren aplicar, tiene que ser residente o ciudadano americano y tiene que ser residente en el condado de Seminole. Estos también tienen que ser los que fueron afectados por su pérdida de trabajo o tienen menos horas en el trabajo que están ahora mismo. En este momento, si van a prepareseminole.org, vamos a tener disponible el mes que viene, al finales de agosto, la aplicación para saber y ganar más información y también aplicar para este programa a lo que necesitan. Y para enterarse para más información de eso, pueden seguir nuestras redes sociales para obtener más información y saber más datos de lo que está sucediendo en estos programas. También vino el supervisor de elecciones del condado de Seminole, Chris Anderson, que le empezó hablando de los boletas por correo que ha enviado 88,000 en estos últimos meses a todo el condado de Seminole. Mencionó también que en las últimas semanas se están escuchando que los residentes están recibiendo correos falsos que dicen que son del condado de Seminole, pero no es. Para asegurarse que que tiene la información correcta y es de la oficina del condado de Seminole, pueden visitar a voteseminole.org o también pueden llamar al número 407-585-8683 que te puede confirmar si fueron ellos que te lo enviaron ese correo o no. También tenemos las elecciones primarias en agosto. Pueden votar temprano de agosto 8 al 15 de agosto de 10 de la mañana a 6 de la tarde. Eso va a ser 7 diferentes sitios que pueden votar. Y a la misma vez el día de elecciones para las primarias de agosto vamos a tener en la fecha de agosto 18, va a haber 80 diferentes lugares donde pueden votar de 7 de la mañana hasta 7 de la noche. Pueden seguir también las redes sociales de ellos en conseguir más información y tener más detalles en votación. También él mencionó que cuando van a votar van a tener las precauciones necesarias. Los empleados deben usar mascarilla, van a estar usando guantes y van a estar desinfectando cada estación cada vez que una persona lo usa. Siguientemente vino el vicepresidente de Relaciones Públicas de OneBlood, Susan Forbes, que mencionó que OneBlood ha recibido un aumento de 500% de órdenes de los hospitales pidiéndole plasma de COVID-19. Este número fue un gran aumento porque es el estilo que están usando los hospitales para ayudar los que están afectados por el virus a recuperarse en la mejor manera posible. Y están preguntando por más y más de donaciones de plasma de cada persona que ha tenido el virus y ha recuperado, porque a la misma vez tienen el anticuerpo que están peleando contra ese virus. Están pidiendo a cualquier persona que ha tenido el virus y podían recuperarse lo más bien, que puedan donar, pueden ir a oneblood.org y pueden donar esa sangre y ayudar a los otros que están afectados en este momento. OneBlood está recibiendo donaciones los 24 horas todos los días en este momento. Apenas que OneBlood reciba la donación, van por un proceso para examinar la sangre y inmediatamente lo envía a los hospitales. El tiempo es esencial en este momento porque más donaciones tenemos, más pacientes se pueden recuperar durante este momento. Está OneBlood recibiendo estas donaciones desde abril y están haciendo este proceso en estos últimos meses y van a continuar haciendo este proceso en el futuro también. Para registrarse y dar estas donaciones a los que tuvieron el virus y recuperaron lo más bien, pueden ir a oneblood.org para buscarse, para registrarse y tener una cita. Esta persona debe tener 14 días sin síntomas y a la misma vez tener documentarios de hospitales o laboratorios que diga que tuviste positivo en el anticuerpo que tienen en este momento. Citas es requerido y deben de buscar cita en oneblood.org. En este momento también el condado de Seminole ha unido con OneBlood en buscando diferentes sitios donde pueden hacer este tipo de donaciones. En lugares de antes que usaban cines, escuelas, universidades y organizaciones religiosas, no está disponible en este momento. Pero si van a oneblood.org o prepareseminole.org, ahí van a tener diferentes sitios donde están usando parques públicos para ayudar en el proceso y dar diferentes sitios para donar esta plasma que están pidiendo para ayudar en el proceso de recuperar a los que tienen el virus en este momento. OneBlood pide que en el momento que se están preparando para la tormenta que debe estar viniendo, que también pongan en la lista que donen sangre o la plasma que tengan para ayudar a los que están afectados en este momento. Finalmente habló el director manejo de emergencias del condado, Alan Harris. Empezó hablando que desafortunadamente en las últimas 2 semanas ha habido mucho más fallecidos y en total había 72 que han fallecido por el COVID-19 en el condado de Seminole. La mayoría tienen 55 o mayor y tenían condiciones médicas en esos momentos. En este momento hay 242 residentes en casa de salud o casa de rehabilitación que están batallando contra el COVID-19. El Departamento de Salud o agencias para la administración de cuidado de salud también está ayudando a este tipo de casas para recuperar y ayudar a los que están pasando esta batalla del COVID-19. También vemos que la tasa de positividad en el condado de Seminole está a un 10.12%, que es más de lo que queríamos, pero todavía estamos positivos que la situación se va a mejorar. Vemos en las últimas 2 semanas teníamos 3.250 casos positivos y hoy tenemos 3.299. Son 49 casos más. Pero vemos que todos los días estamos recibiendo más casos, pero a la misma vez vemos más casos recuperándose. Por las últimas semanas se ha quedado estable los números y no había un salto que estábamos esperando después de las semanas del 4 de julio. También vemos en los hospitales que está menos lo que están hospitalizados. Antes había 215 hace 2 semanas y hoy estamos a 150. A la misma vez mencionó que estamos preparando en el momento para la tormenta tropical que está posibilidad de venir de camino de nosotros, que tiene, si se forma en huracán, va a tener el nombre Isaías. En este momento vemos que el huracán o la tormenta tropical puede estar en nuestra puerta este fin de semana. Por esa razón estamos tomando acción en este momento, hoy en día, para prepararnos por si acaso si la tormenta viene en nuestro lado. Empezó preparando los materiales para los refugios. A la misma vez están entrenando nuevos empleados que van a estar trabajando en estos lugares de refugios. Hoy abrió en la ciudad de Sanford lugar para la bolsa de arena para ayudar durante la tormenta, que abrió hoy a las 8 de la mañana. Mañana también va a abrir en la ciudad de Oviedo otro lugar, y el viernes la ciudad de Altamonte también va a abrir otro lugar de dar bolsas de arena. En este momento también estamos pidiendo a los vendedores médicos privados más empleados para ayudar en el lugares de refugio, necesidades especiales. Ahí también vamos a tener ambulancia en cada refugio para ayudar en cualquier situación. En este momento también estamos haciendo un refugio especial solo para los que están que tiene positivo en el COVID-19 para tener más seguridad en los refugios. También mañana vamos a estar contactando a eso, lo que necesitan. Tienen necesidades especiales y necesitan electricidad para cualquier máquina para la medicación que usan o oxígeno en el momento. Ayer también hablamos con los casas de salud y rehabilitación ayudando en el proceso para prepararse y tener los lugares preparados en este momento. Y finalmente vamos a tener este sábado también abierto, como tenemos de lunes a viernes, la línea de residentes que puedan llamar para prepararse para esta tormenta o cualquier otra pregunta del COVID-19. Va a estar disponible de 8 de la mañana a 5 de la tarde. Si tiene otra pregunta o necesitan cualquier otra información, pueden ir a la página preparesemino.org, que se escribe PREPARESEMINOLE.org, o también puedes llamar nuestra línea de residentes, que es 407-665-0000. Gracias.